Hi everyone, it's William. I am in the Grand Salon today at Hotel Schatzalp, which was once Sanatorium Schatzalp. This is the Grand Duke Dmitri Diary series. And I recovered my selfie stick. I mentioned in the last video that I had misplaced it. So I'm happy to have it back, except there's something loose on it, and I haven't quite figured that out yet. So I'm worried about the phone suddenly going slantwise, and I don't know, you'll have to bear with me if that happens while I correct it. So anyway, this was an area for socializing. I think I mentioned that before. It wasn't a place to do the rest cure or to have parties or anything like that, not at the time that Dmitri was here. And there's lots of work going on. The hotel hasn't opened yet. We're getting ready for the summer season, and there's some serious work going on. So that's why things are in a bit of disarray. You can see you have in the background a marvelous picture windows. And on a sunny day, and with a better camera than mine, or at least with someone with knowledge of how to operate that camera to advantage, you would be able to see just an incredible mountainscape. So behind me, you see the windows into the reception area, and I'm going through now into what used to be a ladies' salon and a reading salon. So there were two rooms, and this was not a bar. It's a bar now, the X-ray bar, but sanatoriums did not have bars, so that's not what this was. But two smaller salons, and now we are officially entering the medical wing. Going up some stairs here. The paintings that you see are from, they weren't originally at Schatzalp, they were at the Kurhaus, but the Kurhaus, which is now the Palace Hotel, it belonging, Schatzalp and the Palace have always belonged to the same company, or in this instance, the same private owners. And since the Palace Hotel, the old Kurhaus, has been modernized, these paintings, which I think are all dated around 1913, are up here at Schatzalp. So, and you have various antiques around, like this desk behind me, and there's a case here. The light isn't on, I should have turned it on, with some, an old sort of apparatus to study languages that the patients could use here at Schatzalp, and various other things. Now, definitely, I'm at a slant here. This is the X-ray room, and it has these red lights now, but these panels were used for looking at X-ray images, and we're going to go through it to, we've been in this room before, but not with the selfie stick, so this is one of the doctor's consulting rooms, and it's got the sink where the doctor could wash up, and now it has this big screen TV, which is cool, although not exactly from the sanatorium era. And these are the original built-in wooden cabinets that were here. And here we have a pneumothorax machine. So Dmitri ended up having a pneumothorax, and that was when a lung was artificially collapsed. And sometimes they would fill the empty space then when the lung was collapsed, and the pleural cavity they would fill with some mixture of gas, or sometimes an oleothorax was done with oil. So various things that they could put in there. And here we actually have some, there's one on the desk too, some X-ray plates that, yeah, have, as far as I know, there are only two of them, and they're on glass plates, and they're from around 1918. And one of them you can clearly see cavities in. The gentleman's name was Ernst. I won't say his his last name, and the x-rays were taken in 1918, and I very much doubt he survived because the number of cavities he had in his lungs. So yeah, I am now going to set the whole apparatus here down, and there we go, so that I can read the text. This is part 8 of the long letter, and we will have one concluding part 9, so we're almost done. And as I said yesterday, I'm a little sorry to be done with this letter, but it's also sort of a relief because it's just heartbreaking. You know, you read it and you see how excited Dmitri is and how optimistic, but you know what happened, and yeah, it's a little heartbreaking. Anyway, here we go. Our recap from last time, Dmitri had been on bed rest for 3 weeks, and he made real improvement with his appetite, with spitting less and coughing less, and his temperature going down to normal. And he felt like that there was this kind of mystical aura around him that even his nurse and the doctors could perceive. And that was the reason that he was doing so well. And the problem with that, I mean, I'm glad he had that comfort at that time, a very difficult time when he just arrived at the sanatorium. But on the other hand, the problem with that is that if you attribute, the improvement of your health to your own, what you yourself are doing, then when your health regresses, you are also going to blame yourself, at least if you're being consistent. So that's the problem with that. Anyway, our cast today, we have Dr. Maurer, and we have at a distance the Mikhailovs. If you recall, Mikhailov was a doctor that Dmitri was with, possibly even staying with in Monte Carlo. Okay, so here we go. When I arrived at the sauna, they put me on a scale, of course, and I ended up weighing 60.7 kilograms in my pajamas. The first week passed, and I was called downstairs for a medical exam. One has such exams once a week. I was already much better, spitting less, etc., but I weighed 59.5 kilograms. The doctor calmly remarked, "I thought so. I'll come talk to you today." He arrived, and this is exactly what he said to me, ! When I first arrived at the sanatorium, I looked horrible. The doctor said all this. And now he actually starts quoting the doctor. That before was not a quote, but now he starts quoting the doctor. Okay, I was just terrified for you. The disease was still in the beginning stage in the right lung with an ugly hole, and the left had the kind of cavity that one simply has to stare at and remove one's hat. But in the course of 1 week, you have made un cure remarquable. Forget my French pronunciation. That's the end of the quote. It turns out that I have had this disease for at least 6 or 7 years. When a case has become as serious as mine, it means that over the years, the stuff I brought up every day in the morning infected me and woke up the microbes that all people have in their bronchi. And then one develops a secondary and very virulent inflammation. That's why in London and in April at the Mikhailovs, I complained so much about pain in my bronchi on both sides. So the doctor said, we're quoting again, "We will give you creosote as a disinfectant," end quote. Even railroad ties are treated with creosote. That's an aside that Dmitri makes in parentheses. He injects me with it, and I also take 3 capsules of calcium per day by mouth and receive some kind of calcium injections directly into a vein. And to fight the infection in my bronchi, they give me inoculations of autovaccine. Finally, for stimulating the chest, I get mustard plasters every other day, 20 minutes front and back. When I asked why I had lost weight here at the sanatorium, he took my hand and said, "It's nothing," we're quoting here, "it's nothing, you'll start gaining. The weight loss is normal. There's a reason why the English word for this disease is consumption." Okay, so that is it. We end with the doctor's quote. And so let's talk about this. This is all very, very interesting. So Dmitri, 59, what is it, 60.7. Well, 60 kilograms is 133 pounds. And then he loses 2 pounds and goes down to 130. Or 100, no, yeah, he goes down to 131. Okay, so try to imagine a man who's 6'2", who weighs 133 pounds. I mean, I weigh more than that, and I'm 5'5". So I'm not at my ideal weight. I would be much better off if I weighed 133 or 131 pounds. But, you know, I am not considered obese, and yet here is this man who is so much taller than me, and he weighs 133 and then 131 pounds, and the doctor says that he looked horrifying, and I imagine he did. You know, he must have just been skin and bones, and I don't know if people mentioning this had anything to do with him eventually going to the doctor, but he must have looked pretty shocking. And the interesting thing is that he ends up being a little on the heavy side in the last photographs there are of him in 1941. But we'll talk about that later, and why that would have been the case. Although, you know, what they were doing at the sanatorium, aside from the bed rest and the other kinds of treatment he mentioned, was just feeding people. So he expected to gain weight. But, you know, it's early, and what Maurer is saying is you know, probably true. Anyway, Maurer could see that he was dying. And usually with a person in the kind of shape that Dmitri was in, they would not have admitted you to Schatzalp or one of the private sanatoriums because they didn't want people to die in their establishment. They wanted to show statistics that impressed future clients, and so ordinarily that would not have happened. But whether it was because he was a Grand Duke and brought prestige, or whether it was because during the war the census went down, the number of patients went down, I don't know, but they allowed him to come. And Dr. Maurer says in this instance, when you see that kind of lung that his left lung was, you just want to, you know, take your hat off like you would at a cemetery or in the presence of, you know, at a funeral or something like that. And in another letter that Dmitri didn't write to his sister, but to his private secretary in Paris, he makes a similar statement, but this time he says that Dr. Maurer said to him, well, I thought just all we can do is just measure this man for his angel's wings. So this is a bit problematic because Dmitri finds out early on that that Maurer isn't always honest with him. And in fact, that, you know, if he thinks, well, this guy's just going to die within the first couple weeks, he's not going to tell Dmitri that. He didn't tell Dmitri that, and he was probably right not to tell Dmitri that. But, you know, that was the case at that time. I've read monograph after monograph and paper after paper written by doctors at that time about tuberculosis, and none of them recommend telling the patient if there was a negative prognosis. They simply weren't going to tell the person. They were afraid it would freak them out or that it would be inhumane or whatever. And, you know, I suppose that's debatable. When my grandmother was dying of cancer when she was in her 80s, and she didn't know she had cancer, and she was told she had cancer, and she just collapsed. And my mother was with her, and my mother was haunted by that until the day that she herself died of cancer. She was haunted by that experience that she had with my grandmother, and my grandmother, went to her death horrified also by that experience. So there, maybe there's something to be said for being judicious in what you let out all at once, or keeping in mind what the patient's mental state is. But anyway, it came back. It turned out to be a very negative thing with Dmitri, because then every time he got his hopes up in the future, every time Maurer after a checkup said, "Oh, you're doing great, don't worry about these alarming symptoms, you're improving," he stopped believing it. So we'll see that in the diaries. Okay, cavities. He has a small cavity. He says, the disease is only in the beginning stage in my right lung. Well, if he already has a cavity, I wouldn't say it's in the beginning stage, but apparently he has a massive cavity in his right lung, and that's very, very bad. He could have died at any time from a massive hemorrhage. But this is what tuberculosis does to lungs. Serious tuberculosis, it eats holes in them. And so those holes are very dangerous. They can, burst through to the pleura and cause a massive infection. They can, cause a huge hemorrhage that will kill people very quickly. And not only did Dmitri have this huge cavity in his left lung, but he also had, as I mentioned in the last video, a co-infection. And he was told that co-infection was gangrene. And so what he's talking about, what the doctor told him, is that, is that he has had this disease for at least 6 or 7 years. So that would put us back to 33 or before, so late 20s, early 30s. So obviously Dmitri has for a long time had these kind of bronchitis symptoms, like probably what you would call a chronic bronchitis, where every morning, the first thing he has to do when he gets up is bring all these secretions up from his lungs. And so Dr. Maurer is telling him that was problematic, that it allowed for this co-infection, and it disseminated the tuberculosis. But anyway, and it's interesting as an aside that Maurer is speaking French to him. The nurse spoke English to him. I don't know if Maurer knew English. At that time, you could still be a doctor of international renown and go to conferences and that sort of thing and present things in French, so which obviously he spoke. So anyway, that's just a side. But again, returning to this question of whether Dmitri had TB from a very young age, there was this fear that he had it, not so much in childhood, but in youth. He was always really skinny, and he had these symptoms that I believe were psychosomatic for the most part, of weakness and that sort of thing. And, he cleared his throat and he coughed, and on one occasion he even brought up some blood. But, this man was just chain smoking, as I said yesterday or in the last video, and it's just not, it makes perfect sense that he was doing all these things without having tuberculosis. And, the doctor certainly didn't think that he had tuberculosis when he was a young man in his 20s. And they were good at estimating this sort of thing. I don't think they would have missed that. And in fact, interestingly, when there was the fear of him having tuberculosis as a young man, they thought it was throat tuberculosis. And he ended up having that tonsillectomy. And it certainly wasn't throat tuberculosis. He would not have survived that to become a man in his late 40s. Anyway. Then we come to this rather shocking thing about the treatment with creosote. And that was not a standard treatment. I mean, this, as Dmitri rightly points out, it's used to treat railroad ties. So it's a bit horrifying to think about, introducing it into the body. And indeed, he did end up having a very bad reaction to it. But a skin reaction, actually, not so much an internal reaction, or he didn't experience it as an internal reaction. And he didn't tell Maria about that. That's a letter to Kazaninov, the secretary. But anyway, or did he? I don't know. I need to get my letters straight. But anyway, yeah, he had this co-infection that allegedly was gangrene, and the creosote was meant not to help with the tuberculosis, but to get rid of the co-infection. And it was sometimes used in that way, going back to I think the 1890s, and mostly people inhaled it. But it never really caught on, and it certainly never caught on for the treatment of tuberculosis. But it seems like it was more popular in Germany and in Central Europe than it was elsewhere. So yeah, it was used on Dmitri for a while. And indeed, the infection did clear up, the co-infection, whether it was gangrene or not. And, I doubt the creosote. Maybe, I don't know. What do I know? But he's getting mustard plasters, that makes sense. And he's getting calcium. And that's another thing that was tried with tuberculosis, but was judged to be not useful. So it was... because in a healthy immune system, the TB bacilli are walled off behind calcium. The human immune system, if it's healthy, does that to these bacteria. And so the theory was that you would help that along by giving people calcium. So he's actually getting calcium injections in addition to tablets. And I think it was ultimately discovered that not only was it not helpful, but in some instances, people with tuberculosis, for some reason, their body produces, maybe as an immune system response, produces too much calcium, and that can be dangerous. So the treatment that he was getting, it wasn't quite quackery, but it was not helping, I don't think. And anyway, Dr. Maurer was a surgeon, and that was ultimately how Dmitri's tuberculosis was going to be treated, through surgery. So the other thing he's getting is tuberculin. So he talks about an what does he call it? Auto vaccine. So, and tuberculin, and also BCG, it's called, which is, I think came after tuberculin. They are used, at least, I don't know if tuberculin is still used, I think, for a skin test to see if your body's immune system will make this big, if you have a little subcutaneous injection, whether you'll end up with a big welt, and then you'll know that it's positive. And BCG also is used as a vaccine with sort of limited effectiveness. I think it's most effective in children who get the TB vaccine. I think about 70% of them then have resistance to the disease. Don't quote me on that. But I don't think it's very useful for adults who get it. But anyway, it I guess was supposed to, again, stimulate the immune system. But it didn't work. It was, at that stage, they're just throwing everything at this disease that they can. And I think I mentioned before that Prince Theodore Romanov, the son of Sandro and Ksenia, was getting gold injections, and that really was quackery. That wasn't something that had ever been, really taken seriously. So other interesting things, Maurer taking his hand. That's a bit of a touching scene. When Dmitri is obviously alarmed and upset about his weight gain, Maurer takes his hand and says, look, it's all right. And Dmitri obviously appreciated that. So I'm going way too long. Let me just say that, next time we have the 9th and final section of this letter. We have more on the treatment that Dmitri was getting, and we have more on his mystical beliefs, and another one of these little statements in the margin about how the members of the Russian immigrant community are undoubtedly saying nasty things about him behind behind his back. And I think I'm going to do another selfie stick video today, the one that I talked about doing earlier, where I simply walk from the funicular station to the entrance to the hotel/sanatorium, exactly as Dmitri would have done when he arrived here on 2nd September 1939. So thank you for watching this very long one, and hopefully I'll see you next time. Bye.